Hello, everyone, and welcome to another episode of the Overcoming Chronic Illness podcast. My name is Dr. Brian Rade, and I am a naturopathic doctor. And today I am joined by Dr. Diane Mueller. Dr. Mueller is a fellow naturopathic doctor, and she has been working with folks suffering from complex chronic illnesses, I believe with mostly a focus on chronic Lyme, but I'm going to find out more about her background and history coming up soon. And I thought that it would be a great chat to just see what her approach is and just talk a little bit of Lyme for the next 30 to 45 minutes. So Dr. Mueller is just waiting in the waiting room here from the Zoom meeting. So I'm going to pause the recording and I'll be back with Dr. Mueller in just a moment. All right, folks. So I'm now joined by Dr. Diane Mueller. Dr. Diane, thanks so much for joining me today.
Well, thank you so much, Dr. Rade. It's really a pleasure to have this conversation with you.
I'm looking forward to our chat. I know we were just chatting and we're kind of cut from a similar cloth and similar experiences getting into the world of complex chronic illness. So I'm anxious to pick your brain. Just before we jump into the questions, would you mind just sharing with listeners a little bit about yourself, who you are, and how you got involved with complex chronic illness patients?
Yeah, of course. So, just like we were chatting about a moment ago, I had my own version of dealing with complex chronic issues. I wound up having pain and fibromyalgia and brain fog and all these symptoms so bad that at one point I had crazy memory loss. I was forgetting where I lived. I had pain so bad. The way I would describe it is like like my leg was getting sawed off. And it was just getting so severe, the symptoms, that I was actually at one point researching moving to a deserted island, thinking that I was dying. And I just had to find like a cheap little hut someplace to live out my days in peace. And that's when I found that I had Lyme disease and mold illness and, about 20 other chronic toxins and infections and these sorts of things. So that was kind of my own personal journey. And then in my practice, when I first initially started, it was just seeing whoever came into my office. And so it was a lot of chronic fatigue and a lot of fibro and a lot of brain fog and digestive issues. And initially I just started doing some of the very basic foundational stuff that's so important that we do as naturopaths, work on the adrenals and the thyroid and clear infections and pathogens in the gut and heal leaky gut and all of those kind of things. And what wound up happening is people were not getting better. And so, like myself, then I started testing people more and more for Lyme and mold and was finding an abundance of it. And then I was starting to see people recover from these complicated diseases. And once that happened, that's when kind of the niche of working with these complicated scenarios started opening up, because I just started finding that more people were finding me because I was able to, like you, find some of these root causes that other people were just not discovering in their own lab testing.
Makes a lot of sense. And just if, and don't want to get too personal here. If you don't want to go there, it's okay. But I'm sure folks would be curious. And I'm curious because you're obviously a success story because you look and sound like a healthy individual, which is sometimes looks can be deceiving. But assuming that you've come a long way from where you were, I hope, would you mind sharing some of the things that were the most kind of pivotal for you in your health journey?
Oh, absolutely. I'm very fine with going personal, and you are correct. I'm in my mid 40s and I feel way better in my mid 40s than I did in my mid 20s. So that's a pretty exciting thing to be able to say. I run, I snowboard 30 days a year, I lift weights. I'm super super active. And really, as far as like the fundamental, if I could say one fundamental thing, if I had to distill it down to one, which I know we want to be careful about because usually in these complicated scenarios, it's dozens of oftentimes of imbalances and abnormalities we need to correct. But probably the most pivotal thing was moving out of a moldy place. And that's where I see, in like the Lyme community, so many people that make their way to my office have seen dozens and dozens and dozens of practitioners, and they want to try like, the next therapy they've heard of. The one of the hottest topics seems to be right now, like SOT therapy. And so everybody wants to try SOT therapy. And one of the things it's like I really work to help people understand is, like myself, it's like, yes, it's good to have many tools in our toolbox. And that's super important to keep an open mind about all the new therapies that are coming out. But most of the time, I find that if people have tried dozens of therapies and they're not getting better, there's another piece of the puzzle. And for me, as well as what I see in so many people, it's living in such a toxic home environment from an environmental toxin scenario and the inflammation that comes from that, that's really preventing them from healing, not only from Lyme, but from, kind of the whole chronic illness picture.
That's really well said, and sorry for the delay there. My kids are being so loud upstairs. It's a snow day, so I'm
Oh,
doing this from my basement, and so trying to be smooth, and it's not being smooth at all. But they're being really noisy. Um, couldn't have said that better myself, and it's really great, and I'll say refreshing to hear a clinician just come out and say like, yeah, if you've like seen a dozen clinicians and tried a million things to go after like Lyme or whatever the one thing is, and like if you're still not better, or you've hit a plateau, it's like it's probably not that you haven't had the right IV or the right antibiotic yet. It's probably that there's some other thing that's going on that's been missed. And yeah, in my practice, mold is oftentimes a missing piece of the puzzle. But yeah, very, very well said. I'm just wondering, and this might have been a semantics thing, so if so, we can just move right along. But you mentioned about like kind of a toxic environment in the home, and of course, mycotoxins. Very, very important to be aware of. Are there other toxins that you've found that beyond mycotoxins that or like contaminating a person's home, or is it just mostly the mycotoxins?
yeah, it wasn't a semantics thing. So thanks for following back up on that. So I do see in my own personal experience, my feeling is with what I've seen clinically is that mycotoxins are the most common and sometimes like the largest imprint on people, but it can be a wide variety of things, right? So, it's like in Colorado, we have to worry about radon. There's obviously things that get into our soil. I've had situations where all of a sudden glyphosates are really high in a patient's urine. And like this one patient I'm thinking about, we're like, why are glyphosates spiking? And she was living in an apartment complex and learned that just earlier that year, the complex had added some additional pesticides to their spraying process. And there were more glyphosates in actually her air. And then also, when I think about home too, I'm also thinking about not necessarily what's like in the air and growing in the walls, but also like what are we choosing from our home care products, our beauty products? Are we filtering our water? All of these kind of things. And, I think in my mind, that's where it really gets into the genetic component and why I really like some of the new tests on the market around not just looking at genetics that are predisposing people to the biotoxins from things like Lyme and mold, but also the genetics that are showing that, oh, for certain individuals, they might have a tendency for glyphosates or pesticides or BPAs from plastic to build up more than others. Because then I think we can translate that down into what day to day lifestyle choices we need to spend more money on and more time because we're genetically predisposed to the buildup and other things when we're not genetically predisposed. It's like, well, it's still good to do. It's still good to, live as close to a toxic free life as possible. And I say that humorously because we can't ever live a toxic free life, but it really does help us make those choices when we understand the genetics. So yeah, I appreciate you following up with that. It really wasn't semantics. It's like looking at not only like what is happening in the home that's just there that almost happens in almost like this victim type of way where it's like the mold grows, we didn't really do anything, the radon's there, it wasn't a choice we made. So there's those types of things that almost like happen to us, and then there's the environmental toxins in our home that really happen just because of the choices we're making because we don't realize the impact they're having.
Mhm. Right, that makes a lot of sense. And I'm just wondering, circling back to the genetics, are there particular SNPs that come to mind? Like what could you give some examples of some of those genes that would have an impact?
Yeah, I mean, there's two different things. I mean, one, we have like the SNP scenario, right? So we have things like our CBS mutations, right? With the CBS mutation, we might not make as much as much of glutathione, for example. And glutathione is used so much for detox across the board. It's one of our most important detox agents. So there's definitely that. I think there's so many people that go crazy over the MTHFR conversation. I, while I definitely think MTHFR is very important, I have a little bit of a different perspective than a lot of people out there, which is I just hear so many people say, like, I can't detox if I have this. And I really like, to reorient people because of like my feeling when I look at biochemistry pathways and I look at what happens when we can't, when this gene causes us to not activate folate and folate's used for detoxification is that their body has a lot of check and balance options, right? So it's like it does slow things down, it does have potential to impact, but it doesn't mean like detox is completely shut off and somebody is completely screwed for their life either. It's so I look at it as kind of like both and it's important and it's not the only variable. So yeah, CBS is also really important. Like I mentioned, there's a ton of others. There's SNPs that really make a difference with pesticides. And some of what I also look at, they're like Vibrant Wellness is a company that I love, and they have a fairly new genetic test out that really is looking at these SNPs and the RSIDs down to the level where they're not going to come back and say like, oh, it's a CBS mutation. They're actually going to look further down and say, because of the SNP, it's actually a BPA, or because of the SNP, it's actually a pesticide, and be a lot more specific than just saying something like glutathione or, folate, for example. So I really like the work they do, because I think it breaks it down to even a more molecular level from an actionable standpoint. So people know it's not just about taking glutathione, it's about actually avoiding that particular plastic or avoiding that particular pesticide.
Right. So
What are your thoughts on that?
I mean, I think your thoughts largely mirror my own, in that, yeah, like I would certainly have a cringe response if a patient came in saying, "Oh, like I've got the MTHFR gene, like I can't detox, full stop." It's like, oh, no, no, definitely not the case. Um, but yeah, no, I think yeah, definitely would mirror your thoughts on that. I think that's really well said. I'm just wondering about the Vibrant Wellness panel. So is it mostly, it ultimately kind of tells you which chemicals you might have the most issue with. And then I think, as you were saying earlier, the main additional step you could take there would be say, oh, if you have a hard time, dealing with phthalates, you should really avoid phthalates like the plague, because they're going to give you the most trouble. You want to avoid VOCs too, but maybe for you, they're not as big of a deal. Like, is that kind of the punchline?
Yeah, exactly. I look at like the environmental toxin urine tests that tell us like what's in our body. I look at that as like present step around like, okay, you have a buildup of say aflatoxin, the mold toxin, or you have a buildup of the phthalates, like you're saying, like if we have buildup of those from an environmental toxin test, and that tells us actionably right now what we need to do to get them out. But
Mhm.
then the genetic test tells us, okay, these are our predisposed problems. So it tells us more from like a future oriented preventative step, what we need to make sure we do so that we're not having buildups occur in the future. So I really look at them as like, okay, present versus future orientation as far as how we, formulate plans actionably. So that's what I like, is because it's not just about get the stuff out, but it's like, oh, preventatively, lifestyle, like what do I need to focus on the most? What do I need to put the most effort in the future? Like somebody that has a tendency for some of the plastics and the chemicals and plastics to build up in their body, from a genetic perspective, that person better make extra sure that, okay, they are out of water and they stop at a gas station. And it's like, okay, well, nobody should drink out of plastic water bottles as a general rule, but some people might, it's like, okay, you do it here and there, you might be able to get away with it, but the person that tends to have those plastics built up in your body, it's worth the extra dollar or two if you're like end up at a gas station to buy water, to buy the water that comes in the glass, the glass container, and making decisions based upon where you're at from a genetic standpoint that way.
That's very well said. And oh man, I was trying to time the water when you were still talking. I was like, ah,
I know,
it was
as
very
as I was wrapping up, I was like, I think I'm not gonna get this totally right. I could see that.
had some homemade wonderful jerky, and it was very spicy. So I'm like, oh, this is bad timing right before coming on a podcast, but it's lunchtime here, so you got to do what you got to
Yeah,
do.
that's
Anyways,
right.
the comedy of errors continues here with doing a podcast from home. Um, so I do have a follow-up question for you about the genetic side of things, but just before we move on, I'll just quickly mention, as per usual, nothing that's said during an Overcoming Chronic Illness podcast is intended as medical advice. This is all for informational purposes only, and if anyone listening needs medical advice, please talk to your healthcare provider to get that advice. Just where we're having a candid conversation around genomics and whatnot, I'll just ask you this question, because I don't know if you have been seeing more of this in your practice recently or not, but in our clinic, we've just been getting more folks who saw this kind of viral TikTok something or t'other clip. There's this fellow out there was on a very popular podcast and was talking about how, like if you take methylated B12, like you're just, or sorry, methylated folate, you're just gonna, if you have the MTHFR mutation, like you're just gonna feel like $1 million is kind of the take home message. And while over my years of practice, I have seen some patients do, very, very well when they get on some MTHFR, or sorry, on some MTHF if they have the MTHFR mutations. It's usually not like a night and day difference, like heavens open up and a person feels like $1 million. Again, I've seen it, but just not as often as might be implied by some. So I'm just wondering, just for curiosity's sake, how often is methylation support something that makes like a huge difference for your patients, and in what way?
I love these kind of questions. I'm always trying to do this type of math in my head from an estimation perspective.
Mm,
I would, without actually doing a true internal study, right, where I'm pulling data,
mm,
I would guess about 50% of the time. Like it definitely helps sometimes.
mm,
Now, from that standpoint, I also, in that 50% where I find that it helps, I'm also including in my mind the people that we've never tested MTHFR, but they just might have a B deficiency, B
mm,
vitamin deficiency and a folate deficiency, because I think that's true for so many people. And, especially because we do use so many of these B vitamins for detox, and in the type of clientele that we both work with, people are obviously, like, the way I like to describe it to people is that detox is energetically expensive because we use so many vitamins and minerals. We use so many of these foundational building blocks to actually get toxins out. So it actually costs the body a lot. And so, from a standpoint of that, how much of that, say 50% that I see improvement on, how much of that is truly due to the MTHFR, mutation versus like, hey, this is just somebody that is burning through these B vitamins just purely because of necessity from detox.
mm,
I feel like that's a little bit hard to determine. The other thing to add here is B2 riboflavin is a cofactor for the MTHF, gene, or for the MTH enzyme.
mm,
So when we are actually activating that enzyme, and we're needing that enzyme is taking the folate from food and turning it into that methylated form, we can't do that without riboflavin. And so that's another curiosity for me, is like sometimes when I put people on riboflavin instead of methylfolate, sometimes I see improvement there. And so I think so much of it is so much beyond genetics. It depends upon how much the body is utilizing. If the body is also deficient in other things like B2, there's other deficiencies. So I think, and that's what I think I find frustrating sometimes about the MTHFR conversation, is it's so reductionistic.
mm.
And I feel like there's just so much more to the story than that. And I think it really leads people astray to be like, oh, I have this thing. If I just take this one nutrient, everything's going to be better. And
Mm.
I think people can get, disappointed a lot of times that way.
Yeah, that's fair. I didn't mean to talk to you about genetics the whole time, but I just have one more question and maybe another one after this.
No
No
problem.
promises, but I've just got one other one because so I've heard statistics, and I can't say that I've rigorously fact checked this, but I've heard it from like Dr. Paul Anderson, Dr. Ben Lynch, pretty reputable guys in the, docs in the field of genomics. Say things to the, and I'm not speaking for them, of course, but paraphrasing what I understood is that a vast majority of our methylation resources go towards creating creatine and phospholipids, phosphatidylcholine in particular. And I'm just wondering if, assuming that those are numbers that you've heard as well, those are important methylation byproducts. Just wondering if you've seen creatine and or phospholipids, like phosphatidylcholine, as supplements or IVs or something like that being, well, not IV creatine, but phospholipids anyways, being
Yeah.
important for your patients.
I've seen them be, I mean, I use a ton of the phospholipids. Like, I feel like that's just essential part of detox, even beyond methylation, even just from thinking about like a cellular rebuilding standpoint and a, bile standpoint. There's so many different things these phospholipids do. So I do use choline and other phospholipids in a lot of my clients, almost frankly, almost all of them. So I definitely see that as being a component, important part. Creatine, like my understanding of the biochemistry is that creatine winds up sparing SAMe, and SAMe is that major methyl donor of the body. So, chemically speaking, and we look at the science, it makes sense that when we take creatine, we don't use as much SAMe to make the creatine, and therefore we have more SAMe available to do other methylation processes around the body. And I haven't used like a ton of creatine in my practice, not because a a standpoint of thinking like it doesn't affect, people, but just it's one of those supplements that because it's oftentimes in a powder, I have not found the compliance with it in the same sort of way.
Mm.
So I haven't focused on it just because it's been something that unless people are really into using it for muscle growth and it's like that type of clientele, which is not the type of client that I tend to get most commonly in my practice.
Mhm.
It's just not something that I've seen that of all the different things people are taking that is something that people really follow through on. But the science behind it makes sense to me when I look at it.
Makes sense to me too. I've gone down that path with a number of patients, just saying like, hey, like you're on a protocol, we're supporting your mitochondria comprehensively. We're on top of the root cause factors. You're moving in the right direction, but let's see if we can get you there faster. So please try some ribose, or please try some PQQ, or please try some creatine, and just kind of bringing in like a single new variable. I love doing that in practice because my left brain just rejoices whenever something like that is done. Good old empiricism. And I've certainly had some patients where creatine has made a notable difference, but it's not like a huge return on investment, I find.
Mm,
Like, I think the number needed to treat to see a benefit, like an appreciable benefit, is, maybe like in the realm of maybe like 10 to 15 kind of thing. So just a little clinical tidbit. But that being said, if you play with it and have different response, I'd be curious to hear about it. But yeah, the compliance is sometimes an issue. Um, as far as the phospholipids go, I'm kind of on a bit of a phospholipid kick lately, and I've tried phospholipids in an analogous manner to how I just described the creatine, ribose, etc. Gone through a few different phases and like just oftentimes didn't really see a whole lot of benefit. Much to my chagrin, tried IV phospholipids every like 2 years. It'd be like, okay, Paul Anderson's talking about these again, and like I should probably try some lipid replacement therapy, and like swing and a miss, swing and a miss, swing and a miss. Not for everybody. Some folks do well, but not more misses than home runs. And so recently I've been on a bit of a kick because have you heard of a product line called Body Bio? Uh,
yeah, absolutely. Yeah.
and so I've kind of been giving them another try, and I'm starting to see some encouraging results. Not quite to the point where I'm ready to have a podcast episode about it, but I'm cautiously optimistic. And so I'm just wondering, with that long preamble out of the way, bearing in mind that I've been hurt before by phospholipids, so please, just give it to me straight here. What are your, do you mind sharing like kind of go-to brands or products that you might recommend, and kind of what you've seen from phospholipid supplementation?
I've actually used a reasonable amount of the Body Bio one, so that's
Okay.
great that you're going down that road. And the other main one I've used is Quicksilvers.
Oh, okay.
So, yeah, and
What's
I'm a
theirs?
huge Quicksilver fan. What's that?
Me too. What's their product called?
Pure PC.
Oh, okay, okay.
Yeah.
Yeah.
Yeah. And they use so many phospholipids in basically all of their products since they're
Mm,
liposomal and right. So
yeah.
that's a huge part of all their products. So I feel like even when I'm giving their liposomal glutathione, for example, people are still getting an element of the phospholipids.
Mm.
But I do for a lot of people combine them with that pure PC. And some of what I'm curious about with like the mixed results is like, is this because of a phospholipid like is it because of like a cellular wall issue, right, where it's like there's toxins and there's all these problems with the cellular wall, and as we give more phospholipids and the cellular wall repairs, perhaps then there's a huge level of toxic load dump. Like I wonder when you're with what you're seeing, and this is like total theoretical, right? And this is not like something I read in a study or anything, just theorizing on what you're talking about here. Just wondering if what you're seeing with that and the results you've had that are mixed could be in part because of like a true Herxheimer reaction. Do you think that's possible?
It's typically not really been like a flare-up kind of thing. It's
Mm,
been more of just like, and I don't really feel any different being on these. But from what I've understood, from, I interviewed, there's a nutritionist from out in Calgary here, also in Canada, and her name is Justine Stenger, and we had a chat several months ago, and she was talking about how the quality of the body bioproducts is quite a bit different than other ones. So like I'm
mm,
I'm all for like trying to get my patients the best results for the most in the most cost-effective way possible, as I'm sure many of us out there are striving to do. And so
Yes.
it's like, oh, I look on paper and it's like, yeah, I could get the. I mean, I wasn't familiar with pure PC, but I used to recommend. I think it was called Optimal PC by Seeking Health. I was like,
Mm,
oh, I could prescribe that, or like just get some sunflower lecithin, and that's way cheaper, and just we don't have to pay importation costs because it's an American company and various reasons. And so my working theory right now, assuming that I continue to see better effects with Body Bio or other higher quality phospholipid products, is that maybe I was just using like recommending products that were just not high enough quality, would be
mm.
my prevailing theory right now, because I was
Yeah.
just like oftentimes a whole lot of nothing, except in the rare cases where we saw something. But
Yeah.
because I love Quicksilver as well. We can't easily get Quicksilver here in Canada. There's another company called Designs for Health. They kind of put their label on some Quicksilver products, so we can get those. I don't know
Right.
that
Yeah.
we can get the pure PC, but I'm going to look into it now that we've talked about it. Kind of dosing wise, Body Bio versus pure PC, like is it comparable dosing, or is one more potent than the other in your experience?
Not I haven't really noticed anything that I can say dose by dose equivalent, and the reason I feel like for me, like, I start so many people at just, like, minuscule doses of
Mm,
everything, right?
mhm,
Because of such a high level of reactivity. So I don't feel like I can say from one standpoint to another around like, "Oh, I can really compare," just because of how so many of my patients wind up like, I have, like, my goal optimum doses around like, oh, this is where I see people, maybe getting to that say upper limit, right? But so many people don't wind up getting there. So I don't truly have a true comparison. I just start low and see where people get to a point where they are tolerating it and not herxing and and feeling good on the products.
mhm.
Yeah.
And now this is turning into the genetics phospholipid episode, but that's okay because I'm having a great time. Hopefully, you
Me
don't mind
too.
chatting about this stuff. Wonderful. So hopefully, people will enjoy these topics. So you mentioned earlier that I think you said the vast majority of your patients are on phospholipids. So just when you're prescribing those, would you mind just talking a bit about your rationale of like, when you're thinking of bringing this in, like it's like, are you thinking, yeah, yeah, I'll just open it a question there and then we'll see what you say. But,
Yeah, I tend to start with foundational stuff first. So, like when you were talking earlier about, D-ribose and PQQ and like these mitochondria support, that's actually oftentimes one of the first places I start is let's do some thyroid support, some adrenal support, some mitochondria support, using lab tests before we make any of those decisions. But I have found, and again, I just always feel like I want to hyper emphasize for people around like these are patterns, but they're not rules, right? So there's not everybody goes by the same through the same system. But as a general rule, I have found that I really think that people have a easier time detoxing and going through killing protocols and other things when we've like worked on restoring some of these deficiencies and these hormone imbalances first. So I will tend to do that for a lot of people, especially if we see things like DHEA at a 50 or cortisol at a 7, right? These really, really low levels of these hormones. And I'm talking AM cortisol for that, AM serum cortisol for that number. But essentially, so from there, that's when I would tend to, after that, go into more of like a choline protocol, a detox protocol. I tend to do some of the detox most commonly before killing infections, just also thinking of like the thinking process with there is like helping the body get rid of the toxins that are already present before we kill things and they release their biotoxins and we have more toxic load. So once I tend to go through the building, the adrenals, the mitochondria, the thyroid, speaking through sex hormones in there as well. And then oftentimes at that point, that's when I would do more choline and binders and bilia, other types of biliary bile support and those sorts of things.
sorry, I had to mute myself again. Kids are getting rowdy again. Thank you for explaining that rationale. That makes a lot of sense. Um, And I'm just wondering, and again, just you're spinning some good yarns here, and I just really appreciate your clinical rationale, Diane. I'm just wondering if you wouldn't mind just speaking to what are your like, how did you, what were some of the key, I guess, like educational resources or training that you did outside of your naturopathic training, as we were talking about before the recording, we learn a lot of great foundational stuff in naturopathic school. But if you want to get into complex chronic illness, by golly, you got to do extra training beyond that. I know some colleagues listen to these podcast episodes as well, and I'm sure
Yeah.
folks in general might be curious. So, would you mind sharing some of your, what's been instrumental in your education up to this point?
Yeah, I mean, I feel like the one of the thought leaders in the field that I resonate the most with is Dr. Klinghardt.
Mm-hmm.
So I've taken most, at least at the time when I started doing Lyme, I know he's probably had a lot out since then, but I've taken most of his trainings.
Mm-hmm.
So it was huge. His work was hugely fundamental. I went out and I've studied with a few random other people. I did a day with Dr. Sean Naylor locally, Dr. Julie Barter. So I've shadowed other types of Lyme clinicians.
Mm-hmm.
And then from there, it's also just, reading research papers, doing various like CEUs that come, our way online. And what else? Then reading, books like Stephen Buhner's and studying things like even from a Chinese medicine perspective, which doesn't have a lot to say about Lyme, but in Chinese medicine, a lot of the research is on leptospirosis, which is actually a similar type of microorganism as Lyme disease is. So, applying, taking like, okay, well, Chinese herbs and the way we look at the energetics of leptospirosis, and because it's a very similar microorganism, then actually applying some of that theory to Lyme disease as well. So those are the main ways, but I'm always learning and studying and talking to fellow colleagues like you. And I think some of like once we get this foundation, I think that's why, the podcast you're doing is super important because so much of like once that huge amount of foundation gets laid, then it's talking to other clinicians and being like, oh, you have, this is your angle. And that's a different way I've looked and looking at this.
Mm-hmm.
And really just continuing to share ideas with, other people like yourself.
Yeah, it's always really inspiring. And I find that when I go to conferences, especially like, say, the Forum for Integrative Medicine or the ICI conference or something like that, like half of it is just chatting with folks between sessions or over lunch. And like, oh, you learn like about half of your pearls and tidbits from that, the other half from the lectures. So yeah, it's always nice to be
Exactly.
part of those think tanks. Yeah. Well, thanks for sharing that. Yeah, that's great. Yeah, and when I first started getting into complex chronic illness, like Dr. Klinghardt was my like North Star. Like my wife, who's a naturopathic doctor as well, like we just bought as many DVDs as we could, went to his live trainings,
Yep.
and yeah, he's just a wealth of info. So and continues to put out so much stuff. I can't keep up with him,
Yeah.
but yeah, he's
Yeah.
great. So
Yeah.
that's
He really
fantastic.
is.
Yeah. You
Yeah. I'm not
mentioned
surprised you have that background as well, seeing that we, have so many similarities in the way we treat it sounds.
yeah. Yeah. Um, so you mentioned Stephen Buhner as well, and that's a good well, maybe a good segue into just asking you about just kind of getting a little more reductionistic here. But let's say you've covered the foundational factors of a person's health, dealt with any concomitant things, or there's those a miraculous case where there isn't, a bunch of co-infections and mold and histamine intolerance issues, et cetera, going on. But if you were kind of going to piece together just an anti-Borrelia a protocol, say like a persistent borreliosis, not just an acute Lyme or sort of stereotypical Lyme. I'm just wondering if you wouldn't mind sharing some of the agents that you'd consider bringing into the mix from more of a antimicrobial, immunomodulating, et cetera, perspective to kind of focus more specifically on Lyme.
Yeah, I really love the company BioPure for Lyme. So, in speaking of certain agents, I do think it's important to mention companies just from the standpoint of like what I've noticed about products. And so BioPure has a product called Cocktail, which is a combination of a lot of different herbs, including a lot of the herbs that Stephen Buhner talks about, our Japanese knotweed and our cat's claw, for example. And I like combining that with cryptolepis. And cryptolepis is if I had to like come down and pick one herb, and I do not recommend we treat Lyme with one herb, but
Hmm.
if I had to come and pick like my favorite herb across the board to treat Lyme, it's cryptolepis. And so they have a really, really powerful one. So I love combining cocktail and cryptolepis. And what makes cryptolepis so amazing is it really works at those persister forms and those dormant forms, those intracellular forms. And oftentimes we see antibiotics and even things like doxycycline that does such a great job of removing that active form of Lyme from the blood. but also can convert those Lyme microorganisms, the Borrelia microorganisms, into those other types of cystic and dormant forms, right? And Cryptolepis does an amazing job at really getting at those forms. And I think that's one of the reasons it's been so successful. So, like an example of a common treatment I will use is cocktail combined with Cryptolepis, combined with hyaluronic acid, also pulling from some of the things that I learned from Klinghardt around Lyme and living in the joints and using, and like because the hyaluronic acid is one of the things that can feed the Lyme. So then using that hyaluronic acid, the way I describe it to my clients is like, this is basically Lyme bait. We're like giving it at the same time. So we're drawing it out of the joints. So we're having it in like the blood and the extracellular spaces where the herbs are, so that the herbs are actually able to work, and it's almost like not chasing the Lyme away, and speaking very simplistically.
Mm. Yeah, I think Buhner might talk about hyaluronic acid supplements too in his book
Yeah.
as well. Because yeah, I
Yeah.
like come across that too. But yeah, it's a very smart idea to do that. And yeah, Cryptolepis, like it's great. Like I could write an ode to Cryptolepis, and I'm sure you probably felt. I'm assuming you felt in a similar way when for years in clinical practice, like Cryptolepis is just awesome. Like it's so strong, and then within the last few years, there were those couple of petri like in vitro studies showing like which herb comes out heads and shoulders above everything else, like Cryptolepis, hits it in every single form, gets at the co-infection. So yeah, it's
Yeah.
amazing stuff. um
Yeah, that
so-
is one of the studies I'm referring to.
yeah. I'm just out of curiosity, because I remember at one point, I think, because the late Stephen Buhner's significant other, I think Judy or Julie, I can't remember her last name now. She came and taught a course here locally, and I believe, again, don't speak for her, but I'm paraphrasing, that it was like, what would be like the backup if we couldn't get Cryptolepis anymore? Because heaven forbid it should happen. But I believe, if memory serves, she was saying it was the herb Knocklea. I'm just wondering if you've ever used Knocklea before.
No, I've not, but thank you. This is like every time I'm on a podcast, I like always have like my favorite takeaway. So I think you just gave it to me. So I'm
Hey,
gonna look up Knockley. I don't actually use that particular herb.
it tastes as bad as Cryptolepis, which is
Amazing.
yeah, yep. So it's got to be good if it tastes that bad. But yeah, I think it's
Exactly.
African peach pit or something like that is the common name for it. But yeah.
Okay.
Anyways, we've used that in tinctures too, and I can't say that it's better than Cryptolepis, but I just feel better having that Knocklea in my dispensary just in case, for a rainy day.
Yes.
So, yeah,
Thank you so much for that. I
sure.
really appreciate that
Yeah,
pearl.
yeah, my pleasure. And just wondering as well, like as far as Lyme pathophysiology goes, are there specific things that you bring into the mix to kind of help with the more immunomodulation side of things, where Lyme can kind of, and co-infections can kind of hijack our immune system, kind of push us into more of that Th2 dominant mode? And just wondering if there's any specific immunomodulators that you like to use in Lyme or co-infection cases.
I haven't seen in doing line work that I've needed to use things all the time right that way, because what I've seen is like when we're actually treating some of the underlying like other toxins, for a lot of people I've seen like that stuff winds up working its way out. But resveratrol, if I'm going to use one, resveratrol is a very common one that I will use. Grapeseed sometimes will be used as well, but it's really not, I haven't found that to be a common thing that I've needed. Like most of the time, I find that if I'm working on the other building blocks and really supporting like the micronutrient levels, that oftentimes those kind of things and any sort of inflammatory processes and the markers that we're tracking, I've seen a lot of those change on their own. So not a ton. What about you? Curious.
I mean, when I first started, devouring the Stephen Buhner books and was like, oh, this is like my Lyme and co-infection Bible, or Bibles, because there's a few books, but I went down the rabbit hole and was like, okay, like every patient's going to be on, with their consent and if they're agreeing to it and everything, of course, but we're going to get the antimicrobials in there, we're going to get the immunomodulators, we're going to get the organ supports in there.
Mhm.
And so I just had everybody on like, multiple tinctures, and it was working well. But then over time, it was kind of like, when the patient would run out of this or that, it's like they ran out of their antimicrobial prematurely and they flared. That would happen semi-regularly. They ran out of their organ support prematurely and virtually never flared. And then they ran out of their immunomodulating tincture, rarely flared. And then got to the point where it's like, well, Chinese skullcap, it's a good antimicrobial and an immunomodulator. There's a twofer. They're Japanese knotweed, same thing. And so I now just kind of bring those immunomodulators in sort of naturally, but haven't found I needed sort of targeted immunomodulating herbs or other supplements per se. The one kind of asterisk there would be I'm a pretty big fan of, that's putting it mildly, I'm a very big fan of low dose immunotherapy in
Mhm.
that when it works, it's just magic and not everybody needs it. But that would be the one exception where some patients just, that's the missing piece of the puzzle for them. But as you're nodding and smiling, do you have experience with LDI yourself or thoughts on that?
Patients use it with good success. It's not a huge thing that I do in my practice, but it's like one of the side. It's like some of these other types of therapies, like the LDI, as well as even things like Rife machine. Like
Mm,
I've seen them to be very, very supportive therapies, are not huge things that am like are sorry interwoven into my particular protocols.
for
But
sure.
when people ask about them, I tend to be pretty supportive because I have seen positive things.
Mm,
And I haven't seen, anything in those, with LDI or with Rife, for example, where it's like, oh, this is like the stand all be all. You can do this and nothing else and get healed. But I haven't seen that with any single therapy, that it's really the combination of everything that, is where the magic happens.
yep. I keep
Yeah.
waiting for that therapy, and then I'll
Me
be able to
too.
retire and say, just do that, and everything's fixed. But yeah, it hasn't happened yet. So maybe one of these days.
Yes. Yep.
Um,
We're all pulling for that.
indeed. Um, well, just as our time's starting to wind down here, Diane, there's a couple of questions that I like to ask guests if we have time, and I'm particularly curious because, again, we're very similar clinicians, so I'm really curious, extra curious about your answers here. So I'm just wondering, what are some of the things that you're the most excited about in practice right now? Like maybe things that are kind of new to your practice, or things that you're looking into, or yeah, just things that are kind of on more of the cutting edge of your clinical brain.
I'm really excited about anything involving working on the mind and the nervous system because another thing I feel like I've seen in practice is the people that have those recurrences, right? The people that show up my door is like, I was symptom free from Lyme. And all of a sudden, 10 years later, all of my symptoms that were Lyme like are back. Or people that were in my practice and they left in their well in like 2 or 3 years, they come, on my, knocking on my door again, which I say in quotes because I don't have a brick and mortar, I'm all online. But from that standpoint, the biggest reason why I see those things happen is stress. Like it's not the only thing, right? People can move into a moldy place, they can move into, some sort of other place, they can get a parasite and that can wreak havoc. There's a lot of things that can really create that resurgence.
Mhm.
But the number, if I were to like name one thing across the board, it really is in the mind and the nervous system and how easily we can, in stressful states, get our stress, as we all know, is like a part of human existence. We all experience stress at various levels in our lives. So it really comes down to like, remove stressors when you can, but what can we do to actually change how the mind is oriented to the stressor and how the mind processes and deals with the stressor. And so, there's a lot of great, great programs out there. I really love Gupta's program. I'm hearing a lot of patients do really well with Primal Trust program, the Safe and Sound program. So there's a lot of great programs out there. I've developed a system internally called Hack Your Mind that I really only use on my patients, but I've practiced Qigong and meditation since 2004, so 20 years now, I guess. And I've done so much studying on the mind and the nervous system and these sorts of techniques. So a lot of how I've learned and a lot of how I've been taught is developed into my own personal program. But like what I really tell people is I don't really care what program you use. I want you to have something that you resonate with, that you enjoy, so that you do it on a regular basis. Whether it's like you get resonance with mine or you get resonance with another one, it doesn't matter to me. I just want people to do something because I really feel like that nervous system component it's like simple. So when we're saying cutting edge, it's almost a funny thing to say because, there's so many more like advanced types of things. People are doing exosomes and people are doing stem cells and people are doing hyperthermia treatments and there's all these different types of things out there, the SOT like I mentioned, but at the same time the people that I see with the recurrence it's not because of like some revolutionary therapy. It really comes down to most commonly like how regulated they're keeping their nervous system.
Yeah. So many of my guests have been saying that, and I'm mostly interviewing folks that are in the complex chronic illness world and have been at it for quite a while. So, yeah, just when I like to emphasize to the audience, like, pay attention, please, audience. Once again, like, this is a really important thing, and I couldn't agree more. I've been several months ago, we just brought brain mapping and neurofeedback into our clinic, and just loving
Amazing.
that. That's making a big difference, and yeah, just for the longest time, like I made up my own kind of rendition of amygdala retraining because just some folks are like, I can't get through like 20 DVDs and 20 hours of training. It's like, okay, here's the pared down version, and like, yeah, just couldn't agree with you more. That nervous system regulation support so key. What's been really fascinating is seeing that I've had several patients now where they've done like everything under the sun, like treated for mold and metals and Lyme and co-infections, like everything you could think of, supporting their mitochondria at the wazoo. Maybe not enough phospholipids. That's something I'm working on, but and they're like feeling better, but like maybe they're only 70% better, which is pretty darn good, but like still not 100%. And we'll look at their brain map and see like, and they're thinking like there must still be like some biofilms. There's still stuff that we're missing. And then we look at the brain maps, and sometimes, like, yeah, we still see signs of neuroinflammation and whatnot. It's like, okay, what are we missing here? But probably 90% of the time now, it's been like, no, your brain looks healthy as can be, like on a, sort of anatomical structural level, but your nervous system is stuck in sympathetic mode. You're like sympathetic dominant, despite your best efforts. So like that's what we need to work on. It's like really fascinating and vindicating, and a good old confirmation bias to like kind of see that on paper. It's like, wow, because it's when it's theoretical, it's like, well, maybe Dr. Rade, but I don't know really. But then it's like, okay, I guess the piece of paper is telling me that we probably need to work on that nervous system now. So it's been a really nice segue to help encourage folks to work on that level of things. Dr. Diane, we're running down on time here. If you wouldn't mind sharing with folks how they can get in touch with you. You mentioned you have a virtual practice. How can folks work with you? Do you have any online offerings? Where can they find you on social media? Would you mind telling us about those things, please?
Yeah, absolutely. So the easiest thing, I have a URL that's super memorable, even though we'll put everything in the show notes, like you said. So if
Mhm.
you go to solvesickness.com, you'll actually find a free video ebook. So it's an ebook I put together in total video format because I find people in the chronic disease world can't always have the brain, the brain fog so strong sometimes that listening is oftentimes and watching is oftentimes easier than reading. So solvesickness.com is where you'll find that. My practice is at mylimedoc.com. So also pretty easy to remember. And I have a couple different options. Like people do come to the state if, once a year, if they want a one-on-one visit, but I have group programs that are basically educational and self-guided, very, very low price points. And that's how I support people internationally, is through my group education programs. And then I also have training programs for docs. So if you're listening to this and you're, wanting to learn more about how to treat this, I have also very, very low price training programs to really, try to help spread the word of this as easy as possible. So if you go to solvesickness.com, you can find my ebook. Mylimedoc.com is my website. And if you get confused, just Google Dr. Diane Mueller and you'll find everything you need there.
Amazing. Great. And any social media, or are you helping your
Oh
nervous
yeah,
system by
I'm
staying off of
on
it?
most social media,
Okay.
Instagram at my Lyme Doc, Facebook at my
Yeah.
Lyme Doc, YouTube
Okay.
at my Lyme Doc. So
Okay.
my Lyme Doc's your ticket to find me
That's the
from that
one. Man, oh man.
standpoint.
There's some consistent branding, folks. That's very, very nice. And just easier on people's nervous systems. You don't have to remember as much. So
Exactly,
that's wonderful.
exactly. Yep.
Well, Dr. Diane, thanks so much for taking the time to chat with me today. It was a great pleasure, and I'm glad you took the time. So much obliged.
Thank you. Thank you so much, Dr. Rade. It's really a pleasure to speak with you and see so much congruence in how we practice in the world.
Yeah, it was great. Well, and thank you folks for listening to this episode of Overcoming Chronic Illness podcast. Hope that you enjoyed it, and please stay tuned for the next one.